Vice President JD Vance announced Monday that he is referring Minnesota Governor Tim Walz and State Attorney General Keith Ellison, both Democrats, to the Justice Department for a criminal fraud investigation involving social services programs. Minnesota state officials are not above the law, and if they facilitated fraud, lied under oath about what they knew, or harassed and intimidated whistleblowers, they must face justice, Vance wrote on X. The committee's published report alleged that Minnesota state officials, including Walz and Ellison, were aware of widespread taxpayer fraud in federally funded social programs for years and did not take steps to stop it. Walz's and Ellison's offices did not immediately respond to requests for comment on the criminal referral. Still, their spokespeople were dismissive of the GOP report in statements to other news outlets. The committee also wrote a letter urging Vance, in his capacity as head of the White House's task force to eliminate fraud, to review Minnesota's social services programs. Vance was named head of the task force in February after President Donald Trump announced a war on fraud in his State of the Union address. Shortly after that announcement, Vance and Centers for Medicare and Medicaid Services Administrator Mehmet Oz said they were pausing federal Medicaid reimbursements to Minnesota. Trump is weaponizing the entirety of the federal government to punish blue states like Minnesota, Walz said February 25th on X. Minnesota came under federal scrutiny earlier in Trump's second term over allegations of fraud involving daycare centers. The state said in January that child care facilities at the center of those allegations were not operating improperly.
Today, we are sending across 50 Medicaid programs, we are sending letters that will require them to show that they are effectively and aggressively prosecuting Medicaid fraud in their states. And if they do not aggressively prosecute Medicaid fraud, we are going to turn off the money that goes to these anti-fraud units. And I want to say a couple things about this. You may think, obviously, this is a Republican administration. We're all proud Republicans up here. You may think that this is purely a red state or blue state issue. That's actually not true. We see Medicaid fraud issues in Ohio, the state that I used to represent in the United States Senate. We also see Medicaid issues, fraud issues in a state like Maryland, which is obviously a very blue state. But both Ohio and Maryland have worked with us to take this issue seriously. They've worked with the guys behind me. They've worked with our entire team to make sure that they take fraud seriously. Again, this does not have to be a red state or a blue state issue. This is just basic good government. However, states like California, states like Hawaii, states like New York have completely not taken the fraud issue seriously in the Medicaid program. And so for those states that refuse to get serious about fraud, we are going to turn off that anti-fraud money. And if we continue to find problems, we can turn off other resources within their state Medicaid programs as well. Our goal here is not to do that. We don't want to turn off any money. What we want to do is ensure that people are taking fraud seriously. We want to protect Medicaid. We want to protect Medicare. But we can't do that if the states that are administering those programs are allowing those programs to be fleeced by fraudsters. So we encourage, whether it's California or New York or Maryland or Ohio, we encourage people to work with us. We want to help you use technology and other tools to get rid of the fraud, to get to the root of the fraud. We want to help you. But we can only help these state programs if those state programs are willing to help themselves. So these letters are the first step, the first effort to try to force these states to get serious about prosecuting fraud, and that's exactly what we're doing. Let me just talk about one final issue here. We see a lot of fraud in the home health care and in the hospice care system. I think Dr. Oz will probably talk a little bit more about that, but again, you have to appreciate that this fraud issue is fundamentally theft from the taxpayer, but also theft from people who need these programs. Just last month, a California psychotherapist, a woman who had spent 40 years treating patients, helping people deal with problems, found out that her Medicare program had been turned off, that she did not have access to the resources that she had been paying into for her entire life. Why? Because a fraudster had stolen her identity and signed her up for health care services that she didn't need, and so she had been turned off of the health care services that she did need. This happens way too much in the United States of America, and it happens because until recently, we did not have a government or an administration that actually took the fraud program and took anti-fraud prevention seriously. So let me just close with one final observation here. First of all, why are we doing this now? Why weren't we doing this 2 years ago? And the simple answer is because we didn't have a president and we didn't have an administration who took fraud seriously. So I want to thank the President of the United States, though I know he's busy in China. All of these efforts, all of these things that we're finding are because we have a president who has told us, take the fraud issue seriously, get to the root of it, and turn off the money when we find out that money is going to fraudsters. So that's exactly what we're doing. But I just want to say that for me, and I think for a lot of people who are involved in this effort, this is very personal. Because I'm not just the Vice President of the United States. I come from a family, and I grew up in a family where we sometimes benefited from these programs. The generosity of the American people is one of the most amazing things about our country. I think all of us, of course, just passed tax day. None of us like paying our taxes, but we do it. And why do we do it? Because we know that it goes to give a bite to a low-income family that can't afford food. We know that it goes to pay the military who keep us safe. We know that it goes to some essential services. But that trust in our government, that trust in our institution, it depends on us taking that trust seriously. How long are people going to pay into programs if they know that that money doesn't go to a low-income kid who needs health care, but that money goes into a fraudster getting rich? This doesn't work, and this doesn't make sense unless we take fraud seriously. So I'm proud to be part of an effort in our government. I'm proud to lead the effort in our government to finally take fraud seriously. We want to protect these programs for the kids and the families who need them. We want to ensure that the American taxpayer isn't getting fleeced. And I'd say just a few months into it, gentlemen, we have done a very, very good job. Let's keep it up.
In February, we had the largest anti-fraud announcement from CMS the day after the State of the Union address, in which the President created this task force and appointed the Vice President to lead it. Today's effort is larger. It's much larger. And there's a reason for that. Half of the fraud, we believe, in the federal government could be coming out of healthcare services. We're a large rhino that can be stabbed effortlessly by foreign governments, like syndicated criminal entities, and smaller time operators who can take advantage of the system with, as Andrew pointed out, as little as a Medicare beneficiary number, which is basically a credit card, to defraud this system. Unfortunately, that results in about $100 billion of estimated theft just from Medicare and Medicaid. That, just to put it in the context of affordability, which is a very important subtext of this discussion, we would be able to double the life expectancy of the Medicare Trust Fund if we could deal with the fraud issues just in Medicare. So anyone who's out there working their tail off, hoping Medicare will be there with them and for them, and we know many young Americans don't think that's going to be the case, it will be the case. If we take the fraud out, it'll be there for you and your children as well. And stopping this as a means of extending the Medicare Trust Fund is a noble purpose, but as has been pointed out by the Vice President and Mr. Ferguson, it is about the human costs. Because if these fraudsters are willing to take your money, they will definitely steal your life and take your health along the way. So let's transition to the 5 major actions. I'm going to go through them in order. I'll share them with Kim, who her nickname is Killer Kim. Mr. Vice President, you'll learn why in a second. She is unstoppable, and you want federal employees like Kim out there like bulldogs going after this fraud. It's right there for us to find. And if we have partnership with the states, it'll help a lot. First,
we need a better nickname for her if she's going to work in healthcare.
She's a Buckeye. She's a Buckeye, so I gave her a choice. Is that a typical name in Ohio?
I don't.
Okay. California Medicaid deferral that the Vice President mentioned is $1.34 billion. Their submissions of Medicare records and the backup estimates are generating major red flags for us. And we have looked carefully at these records. We are allowed to audit, looking back for a quarter. Dan Brillman, Caprice Knapp, who lead the Medicaid program, spearheaded this effort with a great team. We've discovered $630 million in billing from the folks who are egregiously the top 5% of outliers in billing. This is numbers so big you can't imagine anyone billing for these numbers of patients and that much for each patient. And so we're asking California to clarify for us how it got there.